Well, continuity of care was a long-standing feature, particularly of general practice, for years, but it sort of got slightly out of fashion because people didn't think it was terribly important and life got very busy and all the rest of it. And what's really interesting now is that the latest research is suggesting actually that it's very important indeed, indeed so important that it actually reduces mortality. Well, it goes right back, and my interest is back to the 1970s, and it grew out of the work, my work as a family doctor, because it grew on me that it was more and more important if patients were comfortable with the doctor, and then I realized the more I knew about patients, I thought the better it worked. So I did do a little bit of research on it and showed that in fact a doctor who knew the patients was able to give advice on health education more than if they didn't know who the patient really was. And then over the years we've done a number of studies. I was lucky to link up with some Americans, and particularly a chap called Arch Manus, who was interested in trust, and we did a big study to see if trust was related to continuity, and we found that there was a very strong association that, broadly speaking, the longer patients had a family doctor, the more they grew to trust the advice that they got. And then in another American collaboration with a different set in New York and with Maura Stewart in Canada, we did a 3-nation study to look at the way patients respond to GPs. Responsiveness is a sort of psychological measure of how flexible and adaptable the family doctor is. And what was interesting there is that we found that long continuity led to the patient thinking that the doctor was more responsive. So we had an absolutely fascinating pair that we now discover that patients change. Over time, patients become more trusting. They're not the same all the time. And lo and behold, GPs change. The longer they have it, the GP gets more sensitive to the patient's particular needs. That seems sort of quite exciting. And that then led on to us doing asking a big question, could all this possibly affect death rates? That's the ultimate outcome in medicine. So we did, a team I'm part of in Exeter, did the first systematic review of the relationship between continuity as measured with doctors and mortality, death rates. And we were very interested to find that in fact there's in 18 out of 22 studies we found there was a statistically significant association with lower mortality if the patient had doctor continuity.